I'm Michael Bennett, and today we are covering one of the most consequential decisions you make every single year as a Medicare beneficiary, and something that millions of Americans get dangerously wrong: Medicare Open Enrollment. Every year, from October 15th through December 7th, you have a limited time-sensitive window to review your Medicare coverage, compare your options, and make changes that take effect on January 1st of the following year. Miss that window, make the wrong assumptions during it, or simply do nothing when you should be acting, and you could find yourself locked into coverage that doesn't serve you, paying penalties that follow you for the rest of your life, or losing access to the doctors and medications you depend on. Today we are covering the 5 most serious, most common, and most costly mistakes that Medicare beneficiaries make during open enrollment. Every number and every rule I share with you today is drawn from official federal sources. The Centers for Medicare and Medicaid Services, the Social Security Administration, Medicare.gov, the CMS Contract Year 2026 Final Rule published April 4th, 2025, and the National Council on Aging. My purpose is strictly educational. I am not a licensed insurance agent. I am not affiliated with any government agency. I do not sell Medicare plans. My only purpose, the only reason this channel exists, is to help you understand what you need to know about your retirement benefits. Before we get into the 5 mistakes, let me give you a quick foundation. Medicare is the federal health insurance program for Americans 65 and older. Part A covers inpatient hospital care, skilled nursing facilities, hospice, and some home health care, and is premium-free for most people. Part B covers outpatient medical services and carries a standard monthly premium of $202.90 in 2026. Part C, known as Medicare Advantage, bundles Parts A and B through a private insurer and usually includes drug coverage. Part D is standalone prescription drug coverage. During open enrollment each year, you can switch between original Medicare and Medicare Advantage, change Part D plans, or add drug coverage. Changes take effect January 1st. Now, let's get into the 5 mistakes. Mistake number 1 is assuming that doing nothing is the safe choice. This is by far the most common mistake. Every year, tens of millions of Medicare beneficiaries simply do nothing during open enrollment. They assume that because their plan worked last year, it will work again next year. That assumption costs people real money and real disruption to their health care. Here is what you must understand. Medicare Advantage and Part D drug plans are not static. They change every single year. A plan can change its monthly premium, its deductible, its formulary, the list of drugs it covers and what it charges for them, its provider network, its copays, its prior authorization requirements, and its supplemental benefits. All of these changes can happen overnight between December 31st and January 1st. By law, every Medicare Advantage and Part D plan must send you an annual notice of change, called an ANOC, by September 30th each year, before open enrollment begins. That document outlines every material change to your plan for the upcoming year. Most people do not read it. Some don't even open the envelope. That is a mistake that can cost you thousands of dollars. Your cardiologist may no longer be in-network. A medication you take every month may have moved from a low-cost tier to a high-cost tier. These changes are disclosed in your ANOC. If you don't read it, you won't know until it's too late. For 2026 specifically, these concerns are amplified. CMS data shows approximately 900,000 fewer Medicare Advantage enrollees for 2026 compared to 2025, the first decline in over a decade, driven by insurers scaling back their plan offerings. Even for continuing plans, formulary and network changes have been significant industry-wide. What should you do? When your ANOC arrives in September, read it. Look for 4 things: premium and cost-sharing changes, formulary changes for your specific medications, network changes for your doctors, and changes to supplemental benefits. Then go to Medicare.gov and use the free Medicare Plan Finder tool. Enter your medications and preferred pharmacies to see your estimated total annual costs across available plans. And if you need help, contact your state health insurance assistance program, SHIP, at shiphelp.org. SHIP counselors are federally funded, completely free, and have no financial interest in what you choose. Silence is not a strategy during open enrollment. Mistake number 2 is misunderstanding when Medicare penalties apply and assuming you'll always have another chance. The consequences here are permanent and lifelong. When you turn 65, you have a 7-month initial enrollment period, beginning 3 months before your birthday month and ending 3 months after it. If you don't enroll during that window and you don't have creditable coverage through a current employer, you face late enrollment penalties that never go away. For Part B, the late enrollment penalty is an additional 10% of the standard monthly premium for each full 12-month period you were eligible but didn't enroll. In 2026, the standard Part B premium is $202.90. If you delayed 3 years, you owe an additional 30%. That's $60 and 87 cents more every single month for the rest of your life. Delay 7 years and your premium rises from $202.90 to $344.93 per month permanently. For Part D, the penalty is 1% of the national base beneficiary premium, $38.99 in 2026. For each month, you went without creditable drug coverage. 19 months without coverage equals a permanent $7.40 monthly surcharge added to every Part D premium you ever pay. Now, many people know about the employer coverage exception, but frequently misapply it. If you are still working at 65 and covered by insurance through your own current employer or your spouse's current employer, you can generally delay Medicare without penalty. The operative word is current. Retiree health coverage from a former employer does not give you the right to delay. If you or your spouse retires and that coverage ends, you have an 8-month special enrollment period to enroll in Medicare without penalty. Miss that window and you must wait for the general enrollment period, January through March, with coverage not starting until July 1st, and you will owe the penalty. Federal employees under FEHB face particularly complex rules here. I strongly encourage any federal retiree watching to consult directly with the Office of Personnel Management and a SHIP counselor before making any assumptions about their enrollment obligations. Do not assume you have more time. Medicare enrollment has hard deadlines and permanent financial consequences. Mistake number 3 is not understanding IRMAA and not knowing you can appeal it. IRMAA stands for Income Related Monthly Adjustment Amount. It is an additional surcharge on your Part B and Part D premiums if your income exceeds certain thresholds. It was established under the Medicare Modernization Act of 2003 and is one of the most financially significant aspects of Medicare that most beneficiaries either don't know about or don't fully understand. In 2026, IRMAA surcharges begin when your modified adjusted gross income from your 2024 tax return exceeds $109,000 for single filers or $218,000 for married couples filing jointly. This is the 2-year look-back rule. SSA uses income from 2 years prior. The surcharges are not small. For single filers with 2024 MAG, between $109,000 and $137,000. You pay an additional $81.20 per month for Part B, bringing your total to $284.10 plus $14.50 more per month for Part D. At the highest tier, for single filers above $500,000, the Part B surcharge alone is $487 per month, making your total Part B premium $689.90. For a married couple where both spouses are on Medicare at that tier, the combined annual surcharge can exceed $13,000. Here is what millions of beneficiaries do not know. You can appeal IRMAA if your income has dropped due to a qualifying life-changing event. The most common scenario is retirement. If you retired in 2025, your 2024 income reflects a full year of employment, but your current income is much lower. Medicare is still charging you the higher surcharge based on that old income. You can file Form SSA 44 with the Social Security Administration to request they use a more recent year's income instead. Qualifying events include retirement, reduction of work hours, death of a spouse, divorce, and loss of a pension. You have 60 days from receiving your IRMAA notice to file. Form SSA 44 is available at ssa.gov. Two additional points. IRMAA is calculated per person. A married couple where both spouses are on Medicare will each owe the surcharge individually. An IRMAA applies whether you have original Medicare or a Medicare Advantage plan. Even if your plan covers your Part B premium, you still owe the IRMAA surcharge separately to Medicare. This appeal is underutilized, frequently approved, and potentially worth thousands of dollars. Do not pay IRMAA on income you no longer earn without first exploring your right to appeal. Mistake number 4 is assuming your Medicare Advantage plan covers you the same way original Medicare does. This mistake has profound implications not just for your wallet, but for your actual health care, and it is a mistake born largely from marketing. Medicare Advantage plans are heavily advertised. Dear dental, vision, hearing, gym memberships, over-the-counter allowances. Those benefits are real, but what is frequently not explained clearly is how these plans manage access to care in ways that original Medicare does not. The primary mechanism is prior authorization, requirement that your doctor obtain advance approval from the insurance plan before certain services are provided. Under original Medicare, if your doctor orders a covered service, you generally receive it. Medicare Advantage plans require pre-approval, and if the plan denies it, the service may not be covered. This issue became significant enough that Congress investigated it and CMS acted. In the contract year 2026, Final Rule CMS-4208-F, published April 4th, 2025. CMS strengthened prior authorization protections. Starting in 2026, Medicare Advantage plans must respond to standard non-urgent prior authorization requests within 7 calendar days, down from 14. Urgent requests must receive a response within 72 hours. Plans must now provide more detailed explanations for denials. And critically, once a plan approves an inpatient hospital admission, it generally cannot reverse that approval retroactively while you are already hospitalized. These are real and meaningful protections, but they do not eliminate prior authorization. They make the process faster and more transparent, and they place increased pressure on plans to use automated review systems, which industry observers note may lead to more initial denials that require providers to submit additional documentation. Provider networks matter equally. With Original Medicare, you can see any provider that accepts Medicare assignment, approximately 93% of non-pediatric physicians. With Medicare Advantage, your access is limited to the plan's network, which changes annually. Call your doctor's offices directly every year to confirm they are still in network for your plan. Do not rely solely on the plan's provider directory, which may not be current. One final point on this mistake that I consider critical. If you are currently in Medicare Advantage and want to switch back to original Medicare with a Medigap supplement plan, in most states you will face medical underwriting. Medigap insurers can charge you higher premiums or deny coverage based on pre-existing conditions, unless you are within a protected, guaranteed issue window. Once that window closes, switching back becomes significantly more difficult. Understand this before you enroll in Medicare Advantage for the first time, not after you've been in the plan for years. Mistake number 5 is not knowing about the assistance programs that could significantly reduce your Medicare costs and assuming you don't qualify. This is the most actionable mistake on this list. The first 4 are about avoiding harm. This one is about money you are leaving on the table, often significant money. The first program is Extra Help, also known as the Low Income Subsidy. This federal program helps people with limited income pay for Medicare Part D costs, premiums, deductibles, and co-payments. According to the Social Security Administration, Extra Help can be worth over $2,000 per year in prescription drug savings. In 2026, to qualify as a single individual, your income must generally be at or below approximately $1,903 per month, with resources not exceeding $17,220. For married couples, the income limit is approximately $2,575 per month, with resources below $34,360. Check current thresholds at ssa.gov as these adjust annually. People receiving Extra Help are also protected from Part D late enrollment penalties regardless of when they enroll. The second category is Medicare Savings Programs, state-administered programs that help pay for Part B premiums, deductibles, and co-insurance. The standard Part B premium is $202.90 per month in 2026. A Medicare savings program that covers your Part B premium saves you $2,434.80 per year. Money that stays in your pocket rather than going to Medicare. I want to note something specific about Medicare savings programs in 2026. The One Big Beautiful Bill Act, signed July 4th, 2025, blocked 2 federal rules designed to streamline automatic enrollment into these programs. The Congressional Budget Office projected that approximately 1.3 million dual-eligible individuals would lose or be unable to gain access to their Medicare Savings Program benefits as a result. If you believe you may qualify, do not assume you are automatically enrolled. Contact your state Medicaid agency or your SHIP counselor to verify and apply. The third program is the Medicare Prescription Payment Plan, established under the Inflation Reduction Act. Rather than paying the full cost of expensive medications at the pharmacy when your deductible resets in January, this program allows you to spread your annual out-of-pocket drug costs across equal monthly payments throughout the year. For anyone taking high-cost specialty medications, this can make a meaningful difference in month-to-month cash flow. These programs exist specifically to help Medicare beneficiaries manage their costs. Millions of eligible beneficiaries are not enrolled, not because they chose not to be, but because they didn't know these programs exist or assumed they earned too much to qualify. Let me close by summarizing the 5 mistakes clearly. 1. Assuming doing nothing is safe. Your plan changes every year. Read your annual notice of change. Use Medicare.gov's Plan Finder. Contact your SHIP counselor at shiphelp.org. 2. Misunderstanding Medicare enrollment deadlines. The Part B late enrollment penalty is 10% per year, permanent and lifelong. The Part D penalty is 1% per month without creditable coverage. Know your initial enrollment period and your special enrollment period. Retiree health coverage is not the same as current employer coverage. 3. Not knowing about IRMAA or your right to appeal it. Surcharges begin at $109,000 for single filers and $218,000 for joint filers based on income from 2 years ago. If your income has dropped due to retirement or another qualifying event, file Form SSA 44 within 60 days of your IRMAA notice. 4. Assuming Medicare Advantage works like original Medicare. It doesn't. Verify your providers are in-network every year. Understand prior authorization and understand the implications for switching back to original Medicare before you enroll in Medicare Advantage for the first time. 5. Not applying for assistance programs. Extra Help, Medicare Savings Programs, and the Medicare Prescription Payment Plan exist to reduce your costs. Contact your SHIP counselor or state Medicaid agency to find out whether you qualify. Official sources used in today's video: Medicare.gov, SSA.gov, CMS.gov for the CMS-4208-F final rule, MedicareInteractive.org, NCOA.org, and shiphelp.org. All links are in the description below. I'm Michael Bennett. Retirement Watch exists for one reason: helping seniors understand their benefits. If this video helped you, please share it with someone approaching Medicare eligibility or already enrolled. Subscribe, turn on your notifications, and I'll see you in the next one.